are a few of the things to see on this week's VA News.
VA steps up its efforts to meet the president's deadline to hire mental health professionals.
The nation delivers Valentines, and we salute veteran patients.
VA's Blue Button keeps evolving to help veterans and service members.
That and more on VA News this week.
Hello, I'm Wade Poole with the Office of Information and Technology.
And I'm Terry McCrae, also with the Office of Information and Technology. Thanks for tuning in today. VA is stepping up its efforts to hire more than 1,500 mental health professionals before a June 30th deadline imposed by President Obama. In the last 8 months, since the President issued an executive order spelling out the requirements, VA has hired more than 1,000 mental health professionals and 200 support staff. Dr. Sonia Batten, VA's Chief of the Office of Mental Health Services, and other VA experts testified on how they are honoring the commitment the department has made.
We're fully on track to meet the President's executive order on improving mental health services for veterans and their families. VA provides a comprehensive set of services, and that includes crisis services like our Veterans Crisis Line. It includes improving access to services by providing mental health clinicians directly in the primary care setting. And then we also have tools that help people in between sessions, like our PTSD Coach, which is a free mobile smartphone app. Mental health is seen as just as important as every other part of our veterans' health care. And so we really encourage veterans, if they're starting to notice that, that things aren't going well for them or they're having challenges, we encourage them to come in and talk to their clinicians, because the sooner that you identify there may be a problem and you can get in for potential treatment or resources, the sooner you can get things back on track.
VA employees at facilities all over the country were at their best the week of Valentine's Day again this year. Valentines were delivered in all manner of ways, and the week-long National Salute to Veterans paid tribute to nearly 100,000 veterans who are cared for every day in VA medical facilities. This year's salute chairman is comedian Charlie Murphy, a Navy veteran who is visiting VA facilities for the next several months while on a nationwide comedy tour. We'll have more from around the country in the next show, but here's Melody Mercer with a little history on how the Valentines program got started and how Philadelphia area elementary school children honor veterans this year.
Ever wonder how a tradition got started? Well, one of VA's most successful traditions, originally known as Valentines for Vets, started when a fledgling public affairs officer in Chicago wrote a letter to Ann Landers asking her to solicit citizens to send Valentines to hospitalized veterans.
The first year, Judy Cherry's efforts to enlist Ann Landers' readers garnered 1.5 million Valentines to be distributed across the country. The next year, it grew to 5 million. Today, local schools, libraries, and VA employees make it part of their Valentine's tradition. Judy, now the public affairs officer in San Diego, spent 9 years of her VA career in Philadelphia, where our story continues. At the VA Insurance Center in Philadelphia, Valentines for Vets is a long-standing tradition, especially for Parker Chisholm, who has been making them for all of his grade school career. Now in the 4th grade at Lingelbach Elementary School, he delivered 100 Valentines to his mom, insurance supervisor Grace Parker. Allison Silver, daughter of insurance supervisor Sue Silver, has also been making Valentines since 1st grade, except that Allison is now the youth service assistant at the Levittown Public Library. She solicited Valentines for kids in 7 different Bucks County branches, collecting over 500 Valentines. Some went to the 104th Cavalry, currently stationed in Kuwait, via Philadelphia Veterans Service Center employee Donna Barrios, whose husband is a reservist with the unit. The rest made their way to the Philadelphia VA Medical Center, joining the 106 Valentines made by Julia and Mary Keith and their classmates at the Point Pleasant Elementary School. Julia and Mary are in the 2nd and 4th grade and the granddaughters of insurance staff member John Scott McAllister. John shares what started as a project with just his granddaughter's classes last year and grew to the entire 2nd grade this year. Both John and Lawrence Owens, president of the Employees Association, were not only impressed with the effort, but the remarkable sentiments of these young people.
They say things like, we love you, I love you, thanks for serving our country. A couple of kids said thank you for safing our country, a spin of keeping us safe. You're our heroes. They said things like that, right from the heart. You're awesome. Thank you, dude. So they expressed themselves in lots of different ways, but it was very, very moving and touching.
I really appreciate you and all of the other soldiers. You are a true hero. Thank you for being a soldier. Thank you, love, Ryan.
To see them, their eyes brighten a little bit as they read the cards. They all loved them. They talked about, well, I'm going to hang them up. And they read them and were touched by the things they said. Now take a look.
That opens up.
It sure does. Take a look at this.
Yes, indeed.
Now Jack wrote it really big. Can you read that?
Thank you, Jack. Dear veteran, you did a great job. Thank you, Jack. That's nice.
There are never too many cards because each card is like a hug that is coming from a child. We get cards across the country, California, Ohio, Delaware. So each card that veterans receive, and they can receive multiple, it's an opportunity for them to always feel that they are remembered and loved. As soon as the cards come in, we start bundling them up. We send them out to our CBOCs, our vet centers, even home-based primary care. Each card that is written is made with love, and our veterans appreciate it. And any card, Memorial Day, Veterans Day, Thanksgiving, even just because cards really do make their day.
So, a tradition that started with a letter to Ann Landers 23 years ago has taught countless school children what it means to be a veteran and shown millions of veterans that they are appreciated. Cupid could not have done any better. From Philadelphia, this is Melody Mercer for VA News.
More and more veterans and active service members are pushing the VA buttons these days. Actually, more than 1 million have pushed our button in less than a year.
Of course, we're talking about the blue button, the centerpiece of the VA and DoD effort to leverage technology to provide more full online accessibility to easily get their lab results, appointments, prescriptions, and other medical records. Here's Dwayne Wingfield with an update on the blue button technology.
We have previously indicated our commitment of both of our departments to a single common joint integrated electronic health record, the IEHR. And today we affirm again our commitment to achieving the President's goal in 2014. Today's meeting was about how to get there, and in the short term we've agreed to improve data interoperability for that integrated electronic health record and allowing VA and DoD patients to download their medical records, what we call our Blue Button Initiative, no later than May of 2013.
In an effort to make access to health information easier, the Department of Veterans Affairs has launched the next phase of Blue Button with even cooler features than before.
Today we have the complete and entire medical record all in one place. And so not only do we have this in a very readable, very structured digital format, we're also tagging it. We're also using something called a meta tag. And you don't need to be a computer scientist to appreciate what that is. It allows that data to be interoperable. So you can take that data from us, and instead of just giving it to somebody else to read, you can use a computer to absorb it, and you can now make it part of your complete medical record.
This new phase includes additional types of information for veterans and military service members. One, in particular, is the VA Continuity Care Document.
The Continuity of Care document is really an industrial specification. So what VA has done again for the first time, again on the leading edge, again in a market-making capability, is we've taken the so-called CCD, the Continuity of Care document, we've implemented for ourselves, but we are now the model and the reference implementation for the rest of the country. And you're seeing, I mean, literally when you came to pick me up, before we had this discussion, we're talking with other healthcare systems throughout the United States that want our software, which we give them to free, right? And that want to be able to replicate what we've done for their patients, many of whom are veterans.
VA Blue Button offers an easy way to view, print, or download your health information so that your health record is available whenever you want it and need it.
It's a huge win for the institutions, it's a huge win for the providers, and most importantly, it's a huge win for the patients. The huge win is that we can start doing the Blue Button exchange literally tomorrow, right? VA is ready. DoD is going to take our software. They're going to take this code. It's in the open source. You can get it at the open source custodian, this thing we call OSERA, which is something that VA helped create. And the DoD is going to take that code, is going to implement it on their networks. We're going to stitch up all the data silos, and then they're going to be able to present a Blue Button 2 just like the one that we have.
As VA continues to improve Blue Button, veterans are encouraged to learn more about its features and how it can enhance your healthcare experience. For VA News, I'm Dwayne Wingfield.
The latest recipient of the nation's highest military decoration, the Medal of Honor, said he was conflicted about receiving the medal. Army Staff Sergeant Clint Romeshay smiled a little, but he was teary-eyed and his lip trembled at times. He said he was crossed between joy for the recognition the medal gives him and his unit and the constant reminder the medal is of the loss the unit endured.
Now, throughout history, the question has often been asked, why? Why do those in uniform take such extraordinary risks? And what compels them to such courage? You ask Clint and any of these soldiers who are here today, and they'll tell you, yes, they fight for their country, and they fight for our freedom. Yes, they fight to come home to their families. But most of all, they fight for each other, to keep each other safe and to have each other's backs. When I called Clint to tell him that he would receive this medal, he said he was honored, but he also said it wasn't just me out there, it was a team effort. And so today, we also honor this American team, including those who made the ultimate sacrifice.
President Obama said Romeshay's gallant actions were conspicuous throughout the day-long attack by 300 Taliban fighters on the unit's outposts in Afghanistan. Did you know, 90 years ago this month, on February 12, 1923, the 114th anniversary of Abraham Lincoln's birth, Vice President Calvin Coolidge dedicated a new Veterans Hospital in Tuskegee, Alabama, the hometown of Booker T. Washington, and his Tuskegee Institute, and the future home of the Tuskegee Airmen. It is right that we remember Tuskegee this month. After all, it is Black History Month, and the hospital may be VA's single most important contribution to African American history. The hospital was for African Americans who served in World War I, a very progressive move at the time. It wasn't the first for African Americans, though. That was the Southern Branch for Disabled Volunteer Soldiers in Hampton, Virginia, first opened in 1870. Despite a large outcry and threats from the Ku Klux Klan, Veterans Bureau Administration General Frank Hines led the successful fight to hire African American doctors and nurses for the hospital. That's this week's show. Thanks for tuning in. I'm Terry McCrae.
And I'm Wade Poole. Have a great day and rest of your week, everyone.